Hi, good morning to everyone. Before we begin, let me ask you a question. So, how many of you know someone who has been affected by breast cancer? Whether a family member, a friend, or even someone in the community. So, this shows us how common and impactful the disease is. So, today we are going to learn about the breast cancer. So, what it is, why it happened, and how it can be detected early, and what treatment are available. So, this knowledge is essential for us as a student nurse, as a healthcare professional, because early intervention can save lives. So the learning outcome for today is at the end of this session, the student will be able to define breast cancer, list the risk factor for breast cancer, explain the clinical manifestation for breast cancer, list the diagnostic method for breast cancer, describe the staging of breast cancer, and explain the management for breast cancer. So just have a look what is the definition for breast cancer. So breast cancer is a disease in which cancer or malignant cells are found in the tissue of the breast. So breast cancer arising from cell in the breast tissue and the growing is not controlled. So what is the risk factor? So the first one is uh, increasing age means over 50 years old. So mean the risk of breast cancer increase with age. So most cases are diagnosed in women over the age of 50. So mean this is often related to the cumulative exposure to the estrogen over time. So the second one is having family members with breast cancer. So it means genetics play a significant role in breast cancer risk. So if you have a close family member, mothers, or like uh, sister or daughter, so who has had breast cancer, so your risk is higher. So this is especially relevant if the cancer was diagnosed at a young age of if there are multiple family members affected. So the third one is had cancer in one breast. So the woman who have a breast cancer in one breast at a higher risk of developing cancer in the other's breast or in others part uh, of the same breast. Then uh, next one is start early menarche before age 12 or late menopause mean after age of 50. So this mean is the woman what we can say is if they are starting menstruation before age of 12 or experiencing menopause after age of 50, that's we call a late menopause. So can increases the risk of breast cancer. So this is because longer exposure to estrogen over a woman lifetime, so can increase the likelihood of developing of the disease. So then never having children or having the first child at the age of above 30 years old. So mean this woman who have never had a children or who have their first child after age of 30 have a higher risk because pregnancy and breastfeeding also have protective effects possible due to the hormonal changes and a favor menstrual cycle. Then the next risk factor is exposure to carcinogen like ionizing radiation. So means exposure to radiation or such as from previous cancer treatment or frequent x-ray can increase the breast cancer risk. And then chemical substance like that we can found in what we can say is some pesticide and also household cleaning products, and have been associated with increased breast cancer risk, and also thought research is ongoing to fully understand this link. Then the other factor that increase the risk, like example fatty foods. So a diet high in saturated fats may contribute to breast cancer risk. So thought the evidence is not entirely conclusive. Then another factor is alcohol. So alcohol, like if taken regular, alcohol consumption is linked to an increased risk of breast cancer, likely due to it what we can say effects on estrogen level. Then so now we move to the clinical manifestation. So the first one is breast mass or lump. So means one of the most common signs of breast cancer is the presence of a lump or mass in the breast tissue, so which can be detected during a breast examination. So this lump may feel firm, irregular, and may or may not be painful. So the next one is nipple discharge. So breast cancer can cause abnormal discharge from the nipple. So this discharge may be blood stained or bloody or clear and watery serous. So discharge that occurs spontaneously as and is not related to breastfeeding or other benign conditions should be evaluated. So the next one is changes in the skin of the breast. So it means skin changes can include redness, dimpling, or appears the orange appearance. So I mean skins that resemble the surface of an orange. So these changes can be signs of invasive breast cancer affecting the skin or underlying tissue. Then the next one is breast asymmetry. So, so the next one, wait there. So the next one is breast asymmetry, that client will complain breast shape and size are different when viewed through a mirror. So breast cancer may cause noticeable difference in the shapes or what we can say size of the breast. So this asymmetry can become more what we say more appearance when viewed in a mirror and may be accompanied by other changes in the breast appearance. So next one is swelling of lymph nodes. So swelling in the lymph nodes, particularly in the armpits, or we call axillary nodes, so may occur if breast cancer cells spread to this node. So this swelling can be felt as lump in the armpit area and may indicate that cancer has spread beyond the breast. Then the next one is systemic symptoms. So means advanced breast cancer may lead to systemic symptoms such as unexplained weight loss, fatigue, and anemia. So these symptoms suggest that cancer might be affecting overall health and causing a more significant impact on the body. So the last one is cachexia looking. So cachexia looking means in advanced stages. So breast cancer can cause cachexia, where is a condition is characterized by severe weight loss, muscle wasting, and general weakness. So cachexia often result from the body response to cancer and can significantly affect a person's quality of life. So for what I can conclude here is breast cancer is remain a significant health issue worldwide, and early detection or awareness and timely treatment play a vital roles in improving survival and quality of life. So for today's discussion has highlighted the importance of understanding the disease and its risk factor. So I will stop here for this session. Then in our next class we will continue by focusing on diagnostic methods, staging of breast cancer, treatment, and also on post-mastectomy exercise, which can crucial for recovery and also improving the mobility and enhancing overall well-being after surgery. So any question for this session? So if no question, so thank you very much and thank you for focusing.